Hello, and welcome to part 2 of cervical and thoracic anatomy. In part 2, we're going to begin by discussing the characteristics of a typical vertebra. And remember, in part 1, I alluded to the fact that vertebrae in different regions of the spine may vary in size and shape, but they are all similar in basic structure. And that's what we'll talk about here. A typical vertebra consists of a body and a vertebral arch. So here, of course, is the anterior body, and then this blue dotted line is meant to represent the vertebral arch. The body is the thick, weight-bearing anterior part of the vertebra. The superior and inferior surfaces of the vertebral body are flat and slightly roughened for attachment of the intervertebral discs, which we'll talk more about later. The vertebral arch is a ring that extends posteriorly from the vertebral body. And again, you can see that here. It is a ring that extends posteriorly from the body. The posterior aspect of the body, along with the arch, form a circular opening called the vertebral foramen. So again, the posterior aspect of the body and the circular vertebral arch form the vertebral foramen. Of course, the vertebral foramen helps make the spinal canal where the spinal cord passes through. The vertebral foramen functions to hold and protect the spinal cord. Okay. A few additional parts that I want you to be familiar with. We're going to look from the superior perspective here and from the lateral perspective here. So first, the pedicles. The pedicles extend posteriorly from either side of the vertebral body, and the pedicle forms the sides of the vertebral arch. So here is this is a pedicle, and this is a pedicle. Okay, so the pedicle attaches directly to the vertebral body and forms the sides of the arch. The posterior part of the vertebral arch is formed by two somewhat flat layers of bone called laminae. Laminae is plural, singular is lamina, and each lamina extends posteriorly from each pedicle and unites in the midline. So let's say that again. The lamina on each side meet the pedicle. So it's pedicle and then lamina. And then the laminas meet in the midline. Now disregard these little structures here for just a moment. We'll talk about those more later. Extending laterally from the junction of each pedicle and lamina is a projection called the transverse process. So remember, we have pedicle here, lamina here. So where the pedicle and lamina meet, we have this transverse process. And of course, we have this on both sides, pedicle, lamina, transverse process. The spinous process extends posteriorly at the midline junction of the two laminae. So again, where the lamina meet in the back, you have a spinous process going posteriorly. The spinous processes are the most posterior extensions of the vertebrae and can often be palpated or felt along the posterior aspect of the neck and the back. And you know that we've used the spinous process of C7 to help us position for a chest x-ray. From the lateral perspective here, extending posteriorly directly from the vertebral body on each side are the pedicles. So again, let's point out the pedicles. You can see this chunk of bone is pedicle, comes right off the vertebral body. And the pedicle ends in this transverse process. Now notice the transverse process is much easier to view looking from the top down. From the side, it kind of is difficult to appreciate on end. Continuing posteriorly from the transverse process on each side, remember, are the two lamina. So here would be lamina, okay? And remember the lamina end in the spinous process here. Other things you should notice from the lateral perspective are the right and left superior articular processes. So let me point those out. If you remember over here, I said just disregard these bumps for a minute. Well, if we look from the lateral perspective, you can see that those bumps are called the superior articular processes. And you have one on the right and you have one on the left. From the lateral perspective, they appear to be superimposed. Okay? Also notice you have an inferior articular process. And of course, there's one on the right and one on the left. Now you don't see that from this perspective because it's underneath the vertebral arch. Okay, but you can see it here on the lateral. These processes compose joints, which we'll discuss more in a little bit. Okay, so to summarize, a typical vertebrae consists of 2 pedicles, 2 laminas, and those help to form the vertebral arch. The vertebral foramen is the hole in the middle where the spinal column passes through. You also have 2 transverse processes which extend laterally, and 1 spinous process which extends posteriorly. And then, of course, each vertebra has a large body. So again, those are typical characteristics of any vertebral body. Each vertebra also has 4 articular processes, 2 superior and 2 inferior, right and left. And again, those create certain joints. So let's take a closer look at the articular processes. Here is the lateral view that we were just looking at. So superior articular process and inferior articular process. And then this is a vertebral body from the front. So you can see this is the anterior body. Here's the spinous process. Here is the superior articular processes, right and left, and then the inferior, right and left. This right here, of course, would be the transverse processes. Okay, now these processes are important, the superior articular processes and the inferior articular processes, because guess what? They join, when you stack vertebrae on top of each other, these surfaces join to make joints. And so we'll talk more about that in detail coming up. In addition to the body and the vertebral arch, the third important aspect of the spinal column are the joints, which I just alluded to. Without joints, the spine would be rigid and immovable, and respiration couldn't occur without the spine because the spine serves as the pivot point for the ribs during breathing. Okay, there are 3 joints in the vertebral column that you need to be familiar with. First, let's discuss the intervertebral joints. The intervertebral joints are amphiarthroidal joints, meaning they allow limited movement, and they are found in between the vertebral bodies. Okay, so intervertebral joints, in between the vertebral bodies. They provide stability and support, but still allow for flexibility and movement. Okay, so that's the first type of joint. The second type of joint in the spinal column is called the costal joint. The costal joint are found where the ribs articulate with the vertebral body and with the transverse process. We will talk more about costal joints when we learn bony thorax, but just to point them out, these little surfaces here are costal joints. So more to come on the costal joints later on. The third type of joint that we need to know is called a zygapophyseal joint. You can see the spelling here, zygapophyseal. So remember, on the previous slide, we discussed the articulating processes. Remember, there is superior articulating process and inferior. You can see them here. So remember, when you stack vertebrae on top of each other, remember how we talked about these surfaces will meet and they will form joints. Well, those joints are called zygapophyseal joints. So think about this. where the superior articular process of one vertebrae meets the inferior articular process of the vertebrae above, that is a zygapophyseal joint. So imagine several vertebrae stacked on top of each other, just like what you're seeing here. This right here is the superior articular process of one vertebrae meeting the inferior articular process of the vertebrae above. Okay? The surfaces where those joints actually touch are called facets, and that is what you see here. Another very important aspect of the spine are the intervertebral foramina, and that is not to be confused with the intervertebral joint that we talked about a minute ago. Along the upper surface of each pedicle, okay, now remember where the pedicle is. It's in between the body and the transverse process of each vertebrae. Okay, so pedicle is going to be right in here. There is a half circle shaped area known as the superior vertebral notch. So see it right here. This is like a half circle. That is the superior vertebral notch. Along the lower surface of each pedicle is another half circle shaped area called the inferior vertebral notch. Well, guess what? When you stack vertebrae on top of each other, that superior notch meets the inferior notch of the vertebrae above, and that forms an intervertebral foramina. Cool, huh? Between every two vertebrae, there are two intervertebral foramina, because remember, there's going to be one on the right and one on the left. And through the intervertebral foramina, you'll have spinal nerves and blood vessels passing. And this will be helpful when we look at a three-dimensional model in lab. The tricky part for you is you have to know which patient position is needed to visualize the right zygapophyseal joint or the left zygapophyseal joint or the right intervertebral foramina versus the left. And to further complicate things, it varies depending on which spine you're imaging, cervical, thoracic, or lumbar. So we will discuss all of that in lab and we will practice, don't worry. Okay, let's move on now to talk a little bit more about those intervertebral discs. Remember, the intervertebral discs are found in between each vertebra, and they are tough fibrocartilaginous discs that provide stability because they are tightly bound or attached to each vertebra. They allow for flexibility and movement and provide shock absorption during movement of the spine. Every vertebra in the spinal column is separated by an intervertebral disc except between the first and second cervical vertebrae. Interestingly, there's no disc there. And the first cervical vertebrae has no body, but we'll take a look at that later. Each disc contains an outer fibrous portion called the annulus fibrosus. So that's what you're seeing here, annulus fibrosus. And then it has a soft, semi-gelatinous inner part called the nucleus pulposus. Okay, now just to orientate yourself, this is anterior. So this above and below this disc is a vertebral body. And then, of course, here's spinal cord passing through the foramen. When this soft inner part, the nucleus pulposus, protrudes through the outer fibrous layer, or the annulus fibrosus, it presses on the spinal cord and causes severe pain and numbness that can radiate into the lower limbs. So let's think about that. If there's a tear in this fibrous portion and this softer portion pushes outward, it can push on the spinal canal, on the spinal cord, and that's what gives patients those symptoms of back pain, maybe numbness and tingling in their legs. That condition is called a herniated disc or herniated nucleus pulposus, HNP. And of course, we'll talk about that more in pathology. Okay, folks, we're going to end part 2 here. Again, this is a lot of information. We will practice with all of this in lab. Don't worry. If you have any questions, let me know.